topic is artificial intelligence tool as good as expert in diagnosis eye problems as in future evolution. Artificial intelligence is simulation of human intelligence process by machines, especially computer systems. These processes includes learning, acquisition of information, and rules for using the information, reasoning that is rules to reach the approximation, and the definite conclusion, and lastly, self-correction, that is self-validation. I'm not going into detail about the where is it is used, but what is the basic of artificial intelligence? There are 3 or 4 steps, but generally for us, it is a deep learning with convolutional network. And here, all the data are input inside the input layer, and there are multiple layers here that that after crossing each layer, our data is validated and corrected, and lastly we get the output as a very correct result. Now, this is a data-driven machine, but here it is at the already supervised. That already data is in the cloud, and we just after catching the picture in front of us, and we transport it is transferred to the cloud, and then it is processed, and we get the correct result. Now, another problem is that with artificial intelligence, that is, as far as supervised learning is concerned, it is good. That is, till now they have the machine learning algorithms are supervised learning algorithms, because its output based on the presence of the same image characteristic that is human would identify, and the scientist can adjust the algorithm if necessary. That is, this is controlled process. However, the Google developed a successful system of Google Brain in 2016. Now, it is an unsupervised black box system where the Google deep learning algorithm teaches itself, not fitted by our human scientists, to correct and identify the diabetic lesion and photographs, even though it is not told that the lesion is looked like. Even then, it estimates, even it is not fed in the data, then even then it gives the result. It is unsupervised black box. So unsupervised system unsettles some specialists with the fear due to unsupervised approach, but fascinates others as a complement to the skill of physician to provide better care. This is a black box phenomena is shown in this picture. Here the data is transferred to the clouds, and even the data is in the system, it is not fed by the scientist, and even then after the black box, it gives the almost very correct result. But sometimes it gives the wrong result also. That is the danger. Now, artificial intelligence is as good an expert in diagnosing the eye problem. Now, serious question is, will it replace the ophthalmologist in future? The role of doctor will continue as a master of art of medicine, which is uniquely human process. So, here is the catch, that if you go for the diagnosis for the retina, in the diabetic retinopathy, here it can be both offline and online. Generally, we have got the devices with offline, but online is also there, where the data and photographs sent to the cloud of database online, and it can be analyze results immediately, and then major players are Google, Microsoft, IBM, and other centers. But it is a very costly affair because the software is costly. The offline analysis is we have with us in some centers in our country, but here the data and photographs are sent to the machine itself and analyze the input, that is gives the result. It has been tested on 4 public available database, visit your DrawNP2 and the DrawB1. The image is obtained from the local eye hospital. It is commonly practiced in our countries in many satellite centers. The process is sensitivity is 92% and the accuracy is 93%. This is the picture we give to the machine taken from the camera, and when it is put offline, then we detect the diabetic retinopathy and the diabetic macular edema from the fundus photograph. It is a potential to provide more efficient and objective analysis of the image prediction of the disease. Now, IDX DRC is the first device in ophthalmology to approved by the FDA using the artificial intelligence. Here, the software program incorporates the deep learning enhancement algorithm. The two images are taken, one at the macula center and one at the disc center, and taken a non-magnetic retinal camera. Usually, it is used by the Topcon, and digital images of the patient are uploaded to the cloud server and the IDX DR software. Two types of results come in. One is the negative for more than mild DR, that is for the here the patient is recommendation for the up to 12 months screening again. Then the positive mild to mild and more than mild DR, it is referred to the eye specialist. So here the sensitivity is 87% and specificity is 89%. It is very easy. It can be handled by the non-eye care professionals. It can be it can be applied also ROP and it can detect the ROP in very early stages. Now, ARMD, it is a very important role in monitoring therapy of the effective ARMD to find out the fluid collection, quantify the amount of fluid, and determine whether the disease is more active or less active than the before. Prediction of earliest ARMD based on doses, prediction of course of the disease, and individual treatment intervals when to give the intervention. There is also it helps in the corneal topography. In IL power selection, we have Hill RBF formula and LEDA super formula. It is both are the artificial intelligence based formula. Keynes formula is also artificial formula. Now, to current limitation of artificial intelligence is the quality of the training sets, the problem of image quality, black box dilemma, and the sometimes the wrong answers like false negative, that is called adversarialization images. Now for these, though there is many problems, but still we have valuable. It is a very valuable research tool and definitely huge role in research and hypothesis generation recovery. And there is augmentation, not replacement of the ophthalmologist. The final decision of management will depend upon the specialist. Mechanics of machines are help the doctor for better diagnosis. The role of doctor will continue as a master of art of medicine, which is uniquely a human process. Whatever be the pros and cons, artificial intelligence is going to transform our healthcare system. It is going to create revolution in ophthalmology. Thank you for your kind attention.